Those who have that opinion will say aye. Aye. Contrary, no. The ayes have it. I understand the next financial review members wish to debate is the financial review of the Ministry of Health. Will members please turn to the Health Committee report? And the question is that the report of the Health Committee on the 2010-11 financial review of the Ministry of Health be noted. Honourable Marianne Street.
Thank you, Mr. Chairman. In an end-of-term review of the New Zealand Government's actions on 5 major health risk factors undertaken by the University of Otago Department of Public Health, the scorecard of this government in its first term is woeful. There were 5 top health risk factors that were assessed in the health portfolio. The first, and they go in order of importance, descending order of importance. The first one was tobacco use, and the summary around progress on that one, Mr. Chairman, was some progress, but gaps remain which need to be addressed if substantive progress towards the smoke-free nation goal is to be achieved. And they say further that there are unresolved issues around achieving the Smoke-Free Nation 2025 goal, notably the lack of any coherent strategy or milestones for achieving this goal. The second risk factor that was at issue in this report was alcohol use. And the report card said some limited plans for legislative reforms that do not adequately utilise major interventions such as alcohol tax. So hardly a ringing endorsement of achievement in that area. The third one, Mr. Chairman, was high blood pressure. And that received a no progress result. No progress on reducing salt intake. Now, it says further that this inaction is problematic, given the many international studies suggesting how cost-effective interventions to reduce salt intake would be. So even the cheap things haven't been done by this government. High blood glucose. Well, we've just had diabetics lined up outside Parliament today, furious at the possibility that they will be required to use an inferior blood glucose meter because of Pharmac's provisional contract with Pharmaco to be the sole supplier of these critical devices. But even when it comes to high blood glucose, what is the scorecard on the government's performance in health? No progress on improving nutrition and mixed progress on supporting enhanced physical activity. Mr. Chair, they go on to say, others have reported on the lack of a national strategy to address obesity and that in New Zealand, quote, population approaches to reduce the burden of obesity have been systematically cut in the last 3 years. For example, the National Healthy Eating, Healthy Action Strategy is no more. Mission On has disappeared. That was a physical activity program. And the requirement for schools to provide healthy food has been abolished. Mr. Chairman, this government's record in the health portfolio is not coming up to scratch. It is not passing. The fifth area was in overweight and obesity, and the comments to that were exactly the same as the previous comments on high blood glucose. In other words, no progress. Mr. Chairman, this is an appalling indictment of what this government has done. But more in the health portfolio, but even more important than that, if we go to immediate data, the data of the last year or so that is under consideration, it is clear that New Zealand is experiencing under this government increasing levels of inequality, higher rates of child poverty, worse levels of housing provision, and the consequent health risks that attend each of those factors, Mr. Chairman. And so, with another report that came out from Otago University by Michael Baker, the New Zealand Child and Youth Epidemiology Service said hospital admissions of children with serious bacterial infections doubled from 210 for every 100,000 children in 1991 to 451 in the meningococcal epidemic in 2001, and that fell back to 377 by 2005 after the epidemic was contained. And why was the epidemic contained? Because a Labour government saw fit to invest in that meningococcal immunisation program. But admissions have risen again since then. Since this government has been in power, they've risen again to 445. Mr. Chairman, this government's record on health is not as the Minister would have us believe.
Dr. Paul Hutchison.
Mr. Chairman, it's an absolute pleasure to be speaking on the financial reviews 2010-2011 because under this national government